In this video, I'm going to be giving you 3 very simple, very effective, and very inexpensive ways that you can treat some of the soft tissue that might be holding you back from your knees over toes mobility. So let's get to it. So a lot of people out there these days are working on their knees over toes mobility. This is a big thing that a lot of people are working on, which I think is awesome. And so for today's video, I just wanted to chime in and give you some soft tissue techniques that you can try on yourself if you do feel that you're being held back a little bit by some mobility restrictions from the muscles and kind of some of the tendinous tissue around your knees and around your ankles. Now, I want to be very respectful of your time here, so I've got timestamps set up in the description box below, so you can easily just quickly click on something if you want to jump to that particular section of the video. And if you want to learn a little bit more about me and what my channel is about and the mission that I'm on, feel free to stick around and keep on watching after the tips that I show you. And now the 3 techniques I am going to show you today are just very simple and straightforward. So take them, run with them if you like them. If not, just forget about them, leave them behind. But we're going to go over how to compress the tissue, how to decompress the tissue, and how to shear the tissue as these kind of different ways to create healthier environments and kind of free up some of that tight bound up tissue in your lower extremities. So when we think about healthy physical movement, how the body's supposed to be operating in a smooth and efficient manner, we want to think of kind of 3 different domains. So that first domain, we're really thinking that we need to have adequate strength around the joints that we're moving. We also need to have adequate mobility around those joints, so the tissues need to be able to kind of move in ways that they're designed to. And that's the domain that we're focusing on today. And then that third domain is your overall movement control or movement quality. Sometimes we call it motor control. Those 3 domains come together to create optimal healthy movement. So just as you work on your mobility that we're going over today, make sure in your future pursuits that as well you're also addressing the strength of those tissues and the actual movement quality control of those muscles and joints as well. Now, when it comes to mobilizing tissues in order to help improve your range of motion with your knees over toes mobility, the 2 main muscle groups that we want to focus on here are the quadricep muscles, the big 4 muscles on the front of the thigh, as well as kind of the calf muscle region on the backside of the lower leg. Now, just as a fun anatomy tip for you, the gastrocnemius muscle, which we often call the calf muscles, there's the kind of inside head and outside head, and then there's kind of one muscle underneath called the soleus. And so the 2 heads of the calf muscle or the gastrocnemius muscle and the soleus muscle underneath all converge down onto the actual kind of Achilles tendon, which attaches to your heel. We call that the triceps surae. So there's a fun anatomy tip for you in case you wanted to learn some anatomy today. Now, it's important to address your quadriceps mobility here because those 4 quadricep muscles converge onto a common tendon called the quadriceps tendon, which attaches to the top of your kneecap. The kneecap is called the patella, and then the bottom of the kneecap has another tendon that attaches from that bottom of the kneecap onto the top of your shin bone. And so restrictions and limitations in the quadriceps muscles mobility is going to influence how far that knee can bend, and that might be holding you back from some of that knees over toes mobility, so that's why we're going to target the quadriceps. Now, when it comes to addressing the calf muscles as well as that soleus muscle underneath or that triceps surae complex that we've mentioned, we got to make sure everything through there is moving good in terms of mobility as well, because those muscles attach onto the Achilles tendon, which attaches onto your heel bone. And then from there, if there's tightness and restriction, that's really going to limit how far you can dorsiflex or kind of pull that ankle upwards, which again is going to limit your knees over toes mobility. So here we go. Each one of the 3 pieces of equipment I'm going to show you can be used for your quadriceps and for your calves as well. Take it, play with it, kind of see what feels best for you. So here we go with the first one. It's my favorite one. It's the most aggressive one, but man, it does some really cool things. So what we're going to do here is we are going to take a barbell and we are going to do a very aggressive form of kind of like a foam rolling technique. Now, I understand not everyone has a barbell at home, but for those of you who are going to gyms, you probably have access to a barbell at a gym, and that's why I'm including this technique for you. So what we're doing here is we are going to think of the muscles on your leg as the dough, and we are going to think of the sleeve of the barbell as a rolling pin, and you are going to be a baker who is kneading the dough. We're trying to get the lumps out of the dough, and we're really trying to influence kind of the quality and suppleness of the muscles and kind of the tendinous tissues that we're going over. So when you're using this barbell to kind of knead the dough like we used in that analogy there, it's important to understand that this is like a more aggressive form of like a massage or kind of a self-treatment technique. So don't be surprised if you're a little sore and tender the first 1 or 2 times that you do this. But again, it's just nothing more than just a way to influence the quality and the overall kind of suppleness of the tissues that we're going over. So you take that sleeve of the barbell, place it right on your thigh, slowly go up and down. It won't be pleasant, but the slower you go, the more time you give that tissue to be influenced by the pressure, kind of massaging the tissues. And then while you're at it, you can even get the outside of the leg along the IT band and the inside of the thigh, kind of the adductor or kind of groin muscles, just because if you're already working the quadriceps, you might as well just rotate your leg a little bit one way and then kind of get those other muscles as well. Now, as you do this, again, don't roll down right to the top of the kneecap. That'll likely be way too uncomfortable. Just kind of roll down until you're an inch or so away from that region. You can kind of, again, lift the bar up gently if you need a little bit less pressure, but take some time to explore how this feels. If you find sore, tender spots, make sure that you go over them more slowly and even just kind of hang out on those sore and tender spots, because that's going to give a little bit more time for that tissue to be influenced by the pressure of the barbell sleeve. Now, in terms of frequency, you can do this as often as you want. The first 1 or 2 times, you might be a little sore and tender doing it, so you might need to wait a day or two until you're kind of ready to do it again. But it's like anything else, the more you do it, the more the tissues start to respond, and then again, you're not as sore and it's much more tolerable. And after a week or two of doing this, it should actually kind of be a night and day difference in terms of how it feels, and you'll hopefully, with any luck, see some improvement in your knees over toes mobility. Now, when it comes to treating your calves with the barbell, the best way to do it that I find is to have your knee on a soft supportive surface, and then you're going to place the barbell sleeve right on the actual belly of the calf muscles, the thick meaty portion of the back of the lower leg there, and you're gently just going to roll up and down. And as you do that, again, when you find a sore or tender spot, try and hang out on that spot for a little longer period of time. Now, I tend to not roll too far below what's called the musculotendinous junction, which is just the area where the thick, meaty muscle bellies kind of start to become more thick, gristly, tendinous tissue. That spot gets really tender, so I will go down to that spot and hang out there for a moment, but I don't go far below that just because, again, now we're just kind of going right over tendon, and it's sometimes not the greatest feeling. But play around with it. We're all a little bit different, so find what works best for you. Now, here's a pro tip for you. If you want to have a little bit more fine-tuned movement control and quality as you do this, you can take a traditional spring-loading collar and you can slide it onto the sleeve of the barbell, and you can almost use that as a little handle or a throttle as you kind of just gently throttle up and down over the belly of the calf muscles. Again, the first couple of times you do this, you'll likely find that it's pretty sore and tender, but the more you do it, the more that tissue tends to respond to the treatments that you're giving it, and then it won't be as uncomfortable during, and you'll probably have less soreness afterwards. Now, for the second technique here, we are going to do a technique called voodoo flossing, which is sometimes often called compression flossing. And this is a pretty neat thing that's kind of come up in the world of movement sciences and kind of human physiology over the last couple of years, because there's actually some good science to show that this kind of compressive flossing or voodoo flossing can actually create some pretty cool changes in range of motion around the joints. Now, flossing tends to work by creating a compressive and a shearing force. What we're doing here is we're kind of pinning down the muscles and kind of tendinous tissues near and around the joints. And then while they're kind of pinned down, we force the joint to go through ranges of motion, and it creates this shearing component type of force as well as with the general compression. And we're finding again that it does wind up having some pain relieving benefits afterwards, as well as improving some ranges of motion. So when it comes to using these voodoo flossing bands or compression flossing bands, the brand is irrelevant. All they are just bands of latex that are either 2 inches wide or 4 inches wide. So whichever you get, you're gonna be just fine. Just make sure you don't have any allergies to latex. Now, when it comes to the actual technique of how to wrap and use these bands, there's just a couple of principles you wanna keep in mind. So the first one is that when you wrap, you always want to wrap from further away to closer towards your body. We call this a distal to proximal fashion. And this is important because there's a lot of kind of one-way valves within your blood vessels. And so if you're wrapping from closer away to further away, you're kind of pushing that blood in the wrong direction. And that can be really tough and aggressive on the one-way valves in some of your blood vessels. When it comes to wrapping, you want to have the first band go around without too much compression, and then the amount of compression you're going to use is going to vary, but most people wind up doing around a 50% type of pull on the band. You can use more or less, but don't make it super aggressive. And then as you wrap, you want to make sure that you're getting about half of the band to wrap over the previous section while the other half goes on the skin. Now, if your skin is sensitive, you can have some clothing on and just wrap over the clothing. I tend to just go right on the skin. But play around and see what's going to work best for you. Now, once you've wrapped that band, you're going to want to tuck the last piece in, and then you're just going to go through movements that feel like it's really kind of challenging the mobility of those tissues underneath. So when I'm treating the quadriceps, I tend to kind of wrap around the base of the quads and kind of go right kind of near the top of the kneecap, but not directly up against it. And then again, I just wind up doing movements that feel good and therapeutic. I can do kneeling lunges, I can do squats, I can do any other movement that just forces the quadriceps to have to move around. And as you do that, you're gonna feel that it's a different challenge for those tissues underneath, and they're really getting kind of sheared and compressed, which again is just gonna help with that overall tissue suppleness. Now, you can keep the band on for a minute or so. The length of time that you have the band on for is going to depend on your tolerance and also the amount of kind of compression that you've wrapped with. So experiment with that and see what works best for you. Now, as a general rule, I tend to keep it below 2 minutes and again, around that kind of 50% stretch, somewhere around there. Sometimes it's less, sometimes it's more, but just make sure that you're being reasonable. Now, when it comes to wrapping the calf region, I tend to kind of wrap slightly below and slightly above and right over that musculotendinous junction, that area where the muscle bellies kind of turn into that thick, gristly tendon tissue. And then I experiment with different movements, but one that is often very effective and kind of deceptive actually is just simple ankle pumps. Pumping your ankles up and down, and you'll kind of feel that the tissues have to operate and move in very kind of different feeling ways, but it's oftentimes very therapeutic. So play around with movements here. You can, again, do kneeling lunges, you can do calf raises, ankle pumps, whatever types of movements that you feel are beneficial for you. Now you can also wrap around the ankle in kind of this figure 8 fashion and then go through some kind of half kneeling lunges and other movements to actually target the ankle joint itself, in addition to kind of treating more of the muscle tissues and tendon tissues on the backside of the lower leg. All right, now we're on to the third technique. And in the first 2 techniques, we were really going after compressive techniques and shearing techniques, but we're gonna switch it up for this third one here. So this third technique is gonna work by kind of decompressing the tissue a little bit, giving the tissues more space to breathe, bring some more blood flow into the region, kind of get that fluid moving better. And we're gonna do this through a therapeutic adjunct called cupping. Now, when it comes to cupping, there are a lot of different ways that people do it, but we need to make this a little bit more aggressive here in terms of really making sure that we're getting the most kind of tissue quality change out of this intervention technique. Now, the research around therapeutic cupping and improving tissue qualities and characteristics isn't super great, so we're gonna go more by anecdotal evidence and anecdotal experiences here, but it's important to keep in mind that the literature shows that there are potential mechanisms that can be beneficial, and the literature also shows that it's pretty safe, straightforward technique that most people can use. So I personally tend to like how this one feels, so I use it a lot. I use it on a lot of my patients who want to try it as well. But again, if you find it doesn't work for you, just don't worry about it and just stick with the other techniques. Now, in order to get the most out of this cupping technique for what we're trying to do with improving kind of tissue dynamics and kind of getting better knees over toes mobility, we're going to use a special type of cup here called a rock pod, which is made by the company Rock Tape. Now, I like these rock pods because they're much more aggressive than traditional cups, and there's a couple of different ways that you can use them based on the amount of force that you need with that decompressive effect. So the first way you can simply use these pods is what's called the plunger effect. You're just going to think of it like a plunger. You're going to kind of push the end of the cup down, and then it's going to create a suction effect so that you have some nice kind of tissue decompression that way. Now, the second way that you can do this, which is much more aggressive, is to do what's called an inversion method, where you're going to flip the cup inside out, stick it on your skin, and then flip it back, and it's going to create a much more powerful vacuum suction effect. Now, this second technique is a technique that I often use, but again, you can play around with it and find what works best for you. Now, the really cool thing here is that while I'm using the traditional sized rock pods that Rock Tape has come out with, Rock Tape has actually come out with even larger size cups recently that'll even have more of a decompressive effect than the ones that I'm using here. And that's pretty cool because the ones that I'm using are actually deceptively high powered when it comes to a vacuum therapeutic effect with that decompression. So when it comes to using the rock pods on the quadriceps, I tend to do it where I put one on the VMO, the vastus medialis obliquus, which is that inside teardrop looking muscle of the quad. And then I put one on the outside region, and then I put 1 or 2 right above. And from there, I just start by contracting and relaxing the quadricep, just contract and relax. And you'll kind of feel that the muscle's kind of moving and operating differently as we've kind of created that vacuum effect and lifted some of the skin away from the tissues underneath. Now, other things that I'll do include squats and even just kind of some leg straightening exercises where I'm sitting on the edge of a bench and just kind of straightening and then bending the knee. Play around with it, see what works best for you. There's no right or wrong way to do it, but you'll be surprised at kind of the amount of kind of therapeutic benefit that this might bring you. Now, when it comes to using these rock pods on the calves, I tend to put just one pod on each head of the calf, so that medial head and that lateral head, and then I might put 1 or 2 below. And then from there, I do my ankle pumps. I might do some toe raises, some little squats or lunges. And again, you're gonna feel that the tissue's just kind of moving and operating differently underneath as you kind of have that decompressive effect going. So that's it for the video. I'm hoping you all got something useful and informative out of it. The techniques are pretty cool. And again, the key is to take them, play around with them, make them your own so that you find out what works best for you. Now, if you found this video useful, helpful, or informative in any sort of way, feel free to hit that like button. That would mean a lot to me. It's really cool to put out some information that I'm hoping is helping all of you. And if you feel that you have more questions about what we've gone over in this video, or you have other techniques that you like to use, I want to hear about them. So please leave them in the comment section below so we can get some good dialogue going on when it comes to moving better and feeling better. Now, if you have made it to this portion of the video, thanks for sticking around. I just want to take a second to introduce myself in case you haven't met me before. My name's Jim, and I'm a physical therapist, and on this channel, I put out all sorts of content around the world of physical therapy, which hopefully helps people learn how to move better, how to feel better, how to get rid of pain, and how to live more active and healthier lifestyles. Now, I also have a soft spot in my heart for helping physical therapy students get through school and become exemplary practitioners, so I oftentimes post content within that realm as well. And so if any of that sounds interesting to you, feel free to subscribe so that you can get all the latest content that I'm putting out here on this channel. So that is it for the video. I hope you are all doing well and continue to make great progress with your knees over toes pursuits. In the meantime, keep looking after yourselves, keep looking after one another, keep making great things happen, and I'll see you in the next video.